structure of the testis. So we have seminiferous tubule to the straight tubule, to the reedy testes, to the efferent duct, to the epididymis, the head, then the body, and then the tail down here. Okay. And then we have the vas deferens. So up here would be the spermatic cord. We have the vas deferens. We have the pampiniform plexus. So if I ask you that on lab on Thursday, the lab exam, and we put testicular data, it's not a wrong answer, but it's not as complete. All right. So it'd be worth 1 point instead of the 2 points for the quiz. Testicular artery, and then this nerve is the genitofemoral nerve. Now we can see that same structure on the chart. You can see it on this upright model. So here is the testis. All right. Here would be the pampiniform plexus, and then this is the skeletal muscle that covers all of that, is derived from the intra-abdominal oblique. So that would be the cremaster muscle. Okay. There's a better view of it over on the chart where it's covering the spermatic cord as well. Now with the spermatic cord, remember we have the superficial inguinal ring, which is the exit or entrance, which is where the sperm is going. And then the deep inguinal ring, you can see on the inside. So this brown structure is the vas deferens, and where it passes through the anterior wall opening is the deep inguinal ring or internal inguinal ring. Okay. So on the female, we'll see that with the ligament. We use the same terms. In the male, all you have to do is find the vas deferens to find that structure. Now on the chart over here, it doesn't look quite as anatomical. All right, but this is referring to these two circles, so that would be the superficial and deep inguinal ring, and a channel between the two is the inguinal canal. Okay, while I'm here, here is the cremaster muscle covering one aspect of the testis. This is a sagittal view, and this is a frontal view. Okay, so this lucky guy has two penises, two different views. All right. And because in the male genitourinary share a pathway, both the male and the urinary systems are shown on that. All right. So we have a vas deferens, then passing lateral to the bladder. And we have 3 glands. So the vas deferens dilates to form the ampulla. Okay. And that joins with the seminal vesicle. That's the first gland. And so the sperm from the vas deferens and the fluid secretions of the seminal vesicle join together to form the ejaculatory duct. You need to see that best on a sagittal view. All right. And then that enters into the urethra, the prostatic urethra, where the urethra passes through the prostate gland. All right. So that's our second gland. Then the urethra passes through the external urethral sphincter. For some reason it's shown here in white, but that's the skeletal muscle, voluntary skeletal muscle for the urethra. So that's the external urethral sphincter, and here it's more of a muscular color. All right, so right here would be the ejaculatory duct, prostatic urethra. This would be the external urethral sphincter. So about that ½ inch or so is called the membranous urethra. It's the more narrow space, so if you're getting catheterized to drain urine from the bladder, it's a little tighter to get the catheter through. And then we have the penis. So this is the penile urethra, which is found within the corpus spongiosum. So another name for it is spongy urethra. And we've got the bulb of the penis here, and that's covered by the bulbospongiosus muscle. This muscle here and this muscle here are the external anal. So they're forming the sphincter around the anal canal. So again, urethral sphincter, urethral prostatic urethra, membranous urethra. Here would be the bulb of the penis with the bulbospongiosus muscle, external anal sphincter. And then we would have the corpus cavernosum. Corpus spongiosum dilates to become the glans penis. Okay? And the skin over the glans is the prepuce or foreskin. That's what's removed during circumcision. Now you can see the corpus cavernosa here is divided into septi. We can't see the crus because the crus is lateral, all right, comes together. This is the midline section, so we can't see the issue cavernosus muscle either, except in the diagram. So these septi create a rigidity along with the dilated arterioles. Some primates, many of the amphibious mammals like whales or porpoises or dolphins have a bone structure, a bone within the penis, so they can have a true boner. Humans can't, all right? So boner is really just the erect penis where the fluid, the blood is filling up the arterioles. So a broken penis doesn't actually occur in the sense of a broken bone, but these septi can be ruptured, right? So the saddest, funniest story I read about how this occurred had to do with a young man too young to know better. Should have known better. Anyway, he decided that he was going to have some acrobatic sex with his girlfriend, and she was about 10 or 12 feet away on the floor, and he was jumping off the couch. And he missed her. They must have both been under the influence, because I don't know that I would have allowed somebody to try to, might land somewhere else, bones or anything else. Anyway, either hit her pubic bone or hit the floor or something, and bent the penis over and ruptured those septi. So that's what it means by a broken penis for the human.
When you watch the Olympics.
I think it would be painful. I wouldn't try to do it on purpose. But it's going to take a while to heal because that's connective tissue, so it's going to take a while for that. So when the penis is erect after it's been ruptured or broken, it kind of dips to one side. A little fat. All right, so before we look at the sperm spermatozoa, so we have these structures here as well.
I'm really proud of us.
So we looked at this in, I'm missing a component, but anyway, here's the muscle that you can see. So this is covering the crus, so that would be ischiocavernosus. And this is covering the bulb and the corpus spongiosum, so this would be bulbospongiosis, okay? And this is the glans penis up here with the circumcised component. And we have the diagram I showed in lecture that shows it without the muscle. So remember, here it is. So where it's attached to the bone, this is called the crus of the penis, crura for plural. This is the bulb of the penis. So that one we can see on a sagittal model. The bulb becomes the corpus spongiosum. That's why we call it the spongy urethra, because it's contained within the corpus spongiosum. And that expands to form the glans penis. Okay? Then the crus, when it's no longer attached to the bone, becomes the corpora cavernous. Right? When we look at the penis cut on cross-section, this would be the normal view. The two corpora cavernosa are dorsal, and the single corpus spongiosum is ventral, containing the urethra. Here's a posterior view of the bladder. We have one on the black and white on the chart there. So here would be the two ureters. Here's the vas deferens coming in and dilating to form the medial ampulla. The more lateral seminal vesicle then joins with it. We can't see the ejaculatory duct because that would be within the prostate gland. Okay? And then down here you're seeing the external urethral sphincter and the bulbourethral glands. That view can be seen a little bit better here. So prostate gland, prostatic urethra, external urethral sphincter, bulbourethral glands. That flushes out any residual urine and lubricates the surface of the glans penis. Here's the bulb of the penis, becoming corpus spongiosum. The crus of the penis becoming the corpus cavernous. wedge section, if you will, through a cross-section of the seminiferous tubule. So this would be part of a circular space, which would be the lumen of the seminiferous tubule. And you expand this all the way around so it looks like a donut. That would be the cells forming the wall of the seminiferous tubule. So out on the lateral, most outer edge of that, we have the spermatogonium, which then develop to form the primary spermatocytes. I won't ask you to tag the secondary because in a true microscope doesn't last long enough for us to actually see it. And then the secondary spermatocytes become the round, small, early spermatids. And those lose cytoplasm to become the late spermatids. Okay, so their heads are still associated with the sustentacular cell, and this is the nucleus of the Sertoli cell, all this purple area. So mature sperm down here has a head, a midpiece, and a flagellum. All right. Within the head, we have the nucleus and the nucleolus. If you have Sprout's lab manual, I think the nucleus is mistakenly supposed to be labeled the acrosome. And the acrosome is actually a sac covering the nucleus. So it would be this orange band there. Okay, like you pulled on a knit cap. So it's a sac of Golgi that's kind of pulled down over the nucleus. And this could be the midpiece containing the mitochondria and the beginning of the microtubules that form the flagellum. Okay, so this is what we call the sperm when it's in the lumen of the seminiferous tubule or moving onward. So the full name is spermatozoa. Okay. All right, so that's the models and the charts, and then I wanted you to, I wrote the 3 E's up on the board in lecture. I wanted to remind you of the innervation. So erection is the dilation of the arterioles. So they fill with blood and collapse the veins, and the penis becomes erect. For everything else that we've talked about, blood vessels are under the control of sympathetic. So they dilate or they constrict as a result of sympathetic